Hi, in this video, I'll be talking about palliative care. What is it? Should you have it? How do you access palliative care and what to expect? Palliative care refers to treatment that manages symptoms, that manages anything you might be experiencing before, during, or after a serious illness, like cancer. When we talk about palliating symptoms, we're talking about alleviating them. Even if we can't get rid of them altogether, we can soften them and make them less severe. Palliative therapy can be given along with curative therapy, or it can be given to people in whom treatment is complete, meaning you're done with all your treatment and you're having symptoms, or it can be done if you decide that anti-cancer therapy is not right for you and you're living with the effects of the cancer itself or its treatment. A lot of people think palliative care is given only in people who are living with severe disease in whom no anti-cancer therapy is working. And that's actually not the case. Palliative care specialists take care of the whole person. You know, we oncologists like to say that we do too, but palliative care specialists, this is their jam. So they can help if you've had surgery for cancer, you're getting chemotherapy and you're having problems with pain or nausea or breathing problems or bowel obstruction. Really, there's no symptom that palliative care specialists can't help with. Now, you might think my oncologist is helping manage my symptoms. Absolutely. We oncologists love to help manage symptoms, but sometimes our focus is on getting you through the treatment, making decisions about the next treatment to give you. And we may not have the type of specialty knowledge that palliative care specialists have. The other nice thing about seeing a palliative care doctor is that you can really wrestle with existential issues. What are your goals of care? Maybe you don't want to tell your oncologist, I'm sick of treatment. Maybe you don't want to tell your oncologist, I'm done getting treatment for cancer. So you can talk with your palliative care specialist or consultant about issues like, what is the point of therapy? Or I'm tired of therapy, or I'd like to make a change. It's really one other person in your court, another person who can focus on your spiritual needs, existential concerns, symptom management, all sorts of things that you may not be able to talk about with your oncologist. If you're dealing with advanced disease and continuing with anti-cancer treatment is not what you want to do, or your doctor has told you there aren't any other therapies to try, a palliative care specialist can talk with you about your goals of care, managing your symptoms, making decisions for you and your family. Palliative care teams help with family members in ways that many other specialists can't do. They can have those important conversations and help you make decisions about what's best for you and your family. How do you get to see a palliative care specialist? Well, it's possible that there's a palliative care specialist nearby in the hospital near you, or that your oncologist knows a palliative care specialist. I will be honest, there is a shortage of palliative care specialists, but that doesn't mean you shouldn't look. A lot of people, when they hear about palliative care, they wonder, why haven't I been told about palliative care before? And that's a question we ask ourselves in medicine all the time. In part, it's the workforce shortage, and in part, it's because oncologists tend to think, or many of us think, that palliative care should come in only when we are done with anti-cancer therapy, and that's absolutely not the case. So explaining to your oncologist that you'd like to see a palliative care specialist to talk about important things, to manage certain symptoms, is completely reasonable, and they can help you by making a referral. You can also talk to your primary care doctor about making a referral to a palliative care team. Palliative care teams include physicians, nurses, nurse practitioners, physician assistants, social workers, spiritual care advisors, people who can help you figure out things related to your finances. What palliative care does not do is arrange for care in the home. So that home care services is something palliative care can help coordinate. But palliative care does not mean that you have somebody in the house 24/7. If you are on palliative care at home, which is something that is increasing worldwide, then you can actually get home services. But this, again, is not 24/7 care. That's a misunderstanding a lot of people have. And then when they find out it's not the case, they're really disappointed. In summary, palliative care is a focus on the whole person, on symptoms, no matter where you are in your disease course. Reaching out to, asking for a palliative care consultant can meet many of the needs that you haven't had met yet. I hope this video has been helpful. Click like and subscribe, drop a comment below, and I'm sorry about my dog barking.